now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Evert.
Hello, everybody, and welcome back to another episode of Extracting Wisdom. I'm your host, Brandon Evert, coming to you live from my apartment here in Chicago, where currently the air conditioning has not been turned on yet, and the inside of my apartment is it's like 80 degrees. So I decided instead of sitting around and sweating, I would sweat and do a podcast instead. So either way, I'm sweating, but that's just where we're at right now. But anyway, it has been a long time since I've done a solo episode, so I thought this was the perfect time to reflect on my D2 year, because I am now officially a third-year dental student, and at the time of recording this, it's May 26th. I don't even know what month it is anymore with this quarantine going on. But as of May 26th, today is my first official day, online, of course, e-learning, of my D3 year. So I want to break down my second year and more specifically my last semester for you and give a little life update as to what I have been up to. So this past semester consisted of a lot of different classes. We had complete dentures, oral surgery, some endo, implants, perio, ortho, and treatment planning. So basically this semester was focused on giving us the necessary information to be able to fully treat our patients. And what I mean by this is we learned what each specialty does, basically. So we know when to refer to those specialists, know what those specialists are going to do to our patients, whatever procedure that may be, and then know once those patients are referred back to us from the specialist, then we know what to do in terms of continuing with their restorative care. So I'm just going to go class by class and just kind of give you a brief breakdown of what we did. So in terms of complete dentures, we learned how to fabricate dentures and the entire clinical workflow from start to finish. And you may have seen some pictures of my denture on Instagram that I posted. I've been working on this thing forever. We were just about to turn in our dentures, and then COVID hit. So we had to push a lot of our denture lab work back to this semester. So hopefully we'll be able to get into lab sometime and finish those up. But bilateral balanced occlusion, the first time you do this, it is super, super hard. And basically, if you're a pre-dental student listening to this, bilateral balanced occlusion means that when you're making a full set of dentures, an upper denture and a lower denture, you want to make sure that when the patient moves their jaw to the left or to the right, that you have teeth contacting on both sides. So that's the working side and the balancing side. So the patient has a nice, stable denture that's not popping out. And that's really difficult to do at first because you have to realize how certain teeth are angled and make sure you have proper occlusion and proper angulation so you get all of that to work. And I had some trouble with this. I'm not going to lie. It is a difficult concept at first. And what I ended up doing is I got to a point where I was really close to finishing my occlusion, but I realized that my lower anteriors were too long. So I got so frustrated with it that I basically just pulled all the teeth out and started all over. And you may be wondering, like, why did you do that? Well, I really feel that sometimes completely starting over will save you time. And I know it's frustrating, but it will help you learn more than just putting a Band-Aid on something and moving on. So that's what I decided to do. And I think I came away with it a lot more knowledgeable about tooth position and tooth angulation and rotations to really make sure you get a nice bilateral balanced occlusion. So that's basically complete dentures. Everything else is kind of on hold until we can get back into our lab and finish up. I think we have a performance exam to do. We have a monoplane occlusion tooth setup we have to do. So we just have a couple more things to finish that up. In terms of oral surgery, that was pretty straightforward. We really didn't have any clinical component, but it was basically lectures about certain procedures and learning the signs and symptoms of diseases or conditions like pericoronitis and alveolar osteitis or dry socket. And we really did focus a lot on diffuse infections from an infected tooth spreading through all those fascial spaces. And those can get pretty nasty, but it's essential that we know about these, especially as general dentists, so we know how to treat them ourselves, or if they're bad enough, refer to an oral surgeon or to the ER. Endo, pretty much the same thing, very straightforward and lecture-based. We mainly talked about a lot of the more advanced technologies we will be using once we get into clinics, like apex locators, which saves us a lot of time and reduces the number of radiographs we have to take of our patient to find our working lengths. So that's very helpful. Implants. Guys, I think you all know by now that implants are my thing, and I will be learning how to place implants as soon as possible and as soon as I graduate. It's just such an amazing procedure. It's the perfect blend of technology and surgery and aesthetics. And, I've seen firsthand the massive impact on a patient's life that these implants can have. We did have a couple clinical activities still planned that we were not able to complete, but we were able to do a surgical guide for a mandibular implant overdenture. And we also were able to place some Astra implants into a dental model, or like a stone model, which is fun. I always love going through and practicing that. But again, COVID ruined a couple activities that we'll hopefully be making up this summer. We had a Straumann day where we would learn how to place Straumann implants in a dental stone model and kind of learn how their system works. And then I think we also had something with CAD-CAM. I think it was maybe designing implant-supported restorations, just like a single tooth implant. So hopefully we'll get to those. In terms of Pareo, now Pareo was mainly focused on, we only had a couple lectures for Pareo this semester, but they were focused on peri-implant diseases like peri-implant mucositis and peri-implantitis, and their effects on the periodontium and some treatments for those two things. So again, more implants, which I was always happy to learn about. In terms of ortho, it was very lecture-based. We did have a few lab activities that were very basic, though. But one thing I found out was that ortho is not my favorite part of dentistry. I mean, I will gladly do clear aligners for my patients in the future, and I'll definitely learn how to do that. But it's just not as fun or as interesting to me as the surgical side of dentistry and implants. So that's really all I have to say about that. Ortho is ortho to me. And then the last big component of this past semester was our treatment planning course. And this was focused on learning Axiom, which if you're a dental student, I'm sure everybody knows what that is, but it's our dental practice management software, just like EagleSoft or Dentrix. And we pulled everything together that we have learned so far, and we applied it to specific patient scenarios. So our faculty would give us a fake patient with certain conditions or on certain medications. We would get x-rays, clinical photos, Pareo charts, and a ton of information. And it was our job then to come up with a treatment plan, identify everything that needs to be fixed within the patient's mouth, and then formulate treatment plans for that patient and upload or put them into Axiom. And I thought this was cool because this is the first time I really felt like I was doing something clinic related or like actually dealing with real live patients, because this is something we'll be doing right off the bat when we see patients and start treatment planning for them. So I thought this was pretty neat and very repetitive, which I think is a good thing just to get into the swing of generating treatment plans and learning how to do that within Axiom. So those were the major components of this semester. And this summer, we're supposed to be seeing our own patients, but obviously COVID kind of pushed that back, and I really just can't wait to get into clinic. But once I do, I will be sure to update you guys once I start seeing patients and share my first patient experience with all of you. I think how it's going to work for now is that our school is going to be open starting, I think, at 7:30 in the morning, closing at 7 p.m. So it's going to have extended hours, and then we will have small groups of students rotating through different time slots throughout the day. But the problem is, as you know, dentistry generates a ton of aerosols, and so our clinics are only able to operate at half capacity. So every other chair in our clinic will be used. And then the next day it'll switch to the other chairs while the previous chairs are cleaned and disinfected. So this is great, obviously, to reduce the spread of COVID, but then that means that there is half as many patients seen per day. So what is going to happen is the third years are going to be paired with fourth years, and then we will work together to treat the patient. And based on requirements and what each patient needs in terms of competencies and certain number of credits and those types of things, either the third year or the fourth year will take the lead on that patient for that day. So if I'm a third year and the patient needs a crown prep, obviously the fourth year probably has enough crown prep, so the third year will take the lead and the fourth year will assist the third year. And then, it could be, if a fourth year needs one last denture case, then they'll take the lead on the denture, and the third year will assist. And I think this is a great way to start clinic. I know obviously we're not going to have as much freedom or maybe not as much personal experience with a patient one-on-one, which I was sort of looking forward to, but I think this is a great introductory way to get into the clinic and have that older student there with you just to kind of guide you, give you some advice, and really get off on the right foot when it comes to treating patients. So yeah, I will for sure be doing an episode on my very first patient experience and just let you guys know how it went. Now, this last semester especially, I kind of want to share one of the biggest things I learned in terms of like studying. If you're somebody who's maybe struggling with e-learning, because that's difficult, because that's really, you're not there in person and you're not in a different place, you're in your home, which some people may have difficulties studying in their own home while everything else is closed out in the world. I really learned how useful the software Anki is. And I know I've talked about this before. It's spelled A-N-K-I. It has proven again and again to be a vital part of how I study for exams. And it really helps me excel on each and every exam I take. So again, I'll explain what Anki is. Anki is a online flashcard software. It is free if you use it on your Mac or your PC, laptop, whatever. It is $25 for the app on your iPad, which sounds pricey, but that's the only way this company generates revenue is from selling the iPad app. But I would strongly encourage you to get that because it's so helpful. But basically, Anki is like I said, a software for flashcards. But what's special about it is that after you answer a flashcard, you get to decide when that flashcard comes back into rotation. So if it's a flashcard that you know like the back of your hand, you can set that to come back in a week or 2 weeks. So you don't have to worry about that. And then if you have a card that you're just not getting the concept, you're having trouble with, you can set that to come back in like 1 minute or 1 day, like more often than the cards that you know. So basically, this software does a great job of weeding out what you know and what you don't, and focuses more flashcards on what you don't know until you get those concepts down. So that's why I really like it. And so let me give you my workflow of how I use Anki. So I will typically be in lecture or at home listening to an online recorded lecture, and I will make flashcards. I'll have Anki open typically, and I will dual screen it on my iPad with the lecture. And as we go through the lecture, I will either type things down or I'll do a lot of screenshots of the lecture and pictures from the slides. And that really helps because by the end of the lecture, I already have my study material. So the very next day, I am already studying that lecture material. And it's an awesome thing because you get to set how many cards you want to review per day, whether that's 25, 50, however many cards you want to do. So it really makes studying a little bit every day a bearable and productive process. So it's not like this daunting thing where you have 1,000 cards the next day and you feel like you have to get through all of those. But I will say with Anki, it does keep you on a schedule because if you don't review that particular day, then they start stacking up, which can feel daunting. So Anki really pushes you to be consistent in your studying. And if you stay consistent, you may only have 10, 15, 20 cards a day to get through. And if you do this day by day, starting day one, you're studying all semester for your exams. So that's why I almost never feel stressed for exams anymore. And as exam approaches, because I know I've been studying for this long. You don't have to do those long marathon study sessions where you're staying up till 3 a.m., 4 nights before the exam trying to cram all the material. That is why Anki is so powerful to me and why I use it, because I wake up every morning, I have my cards for the day, I'll do 10, 15, 20, whatever it is, and then I'm done until the next day. And as the days go on and I add more lecture material, then it kind of starts randomizing the cards that you input. So they don't come back in the same order in which you put them in. And that way you just kind of get all your classes jumbled up into one deck, which some people may not like, but I like studying everything together because then kind of helps you solidify some concepts and tie other things together between different disciplines in dentistry. So that really helps me. And again, because it's all jumbled up, it helps me focus more on knowing the information rather than focusing on my grades. I think there's a big difference when you get to dental school as opposed to like undergrad and high school, where in undergrad and high school, you're focused more on getting good grades, not necessarily knowing all of the material. Where in dental school, I hardly ever think about my grades. And yeah, I get good grades and I'm happy with my GPA, but that is only because I'm not thinking about it. I'm thinking about, do I know all the material that I need to know in order to be the best clinical dentist I can be? So that's kind of my mindset. So if you are not using Anki, I would really, really encourage you to just try it out, because I really think you will enjoy it. It keeps you on a consistent schedule, and I think you will experience less stress as your next exam approaches. So that has been my experience for the last semester of my D2 year, and I'm so excited to get hands-on with my patients. I'm halfway done, guys. I can't believe I started this podcast before I even got into dental school, and here I am, 50-something episodes later, and I'm halfway done, halfway to being a dentist. So it's wild. Another thing I've been up to is, if you are a pre-dental student, this is going to be for you. I know I talk about DAT Bootcamp a lot, but I am now on the team for the DAT Booster online software. And I am responsible for I've done some PAT videos, the top front end solution videos, and I've also done pretty much the entire quantitative reasoning videos as well. So if you do become a member of DAT Booster, you will see me walking you through those questions there. And I think this is just a great software. DAT Bootcamp is very good. DAT Booster, I think, has great content as well. The one thing that DAT Booster has that maybe DAT Bootcamp doesn't have, or is not as advanced on, is their PAT stuff. So they have a great generator for every question that you have, whether it's a keyhole or a top front end or a pattern folding. It has really nice animations and a way for you to drag your mouse and actually rotate the objects in 3D. This really helps you start visualizing these things in your head so you can answer those questions that much quicker and that much more accurately. So that's been really fun. And so I'm actually working on finishing up the last couple exams for the quantitative reasoning section. So again, if you're become a member of DAT Booster and you're like, what's up? There's a couple exams with no videos. I am currently working on those right now. So hopefully those will be uploaded to the site very soon. Another little announcement, a little housekeeping thing. I only have a few more episodes from the Voices of Dentistry that I will be uploading, in case if you are starting to get sick of the chatter in the background. I know this can be kind of annoying. It's really hard to have a really clean stream of audio in an environment like that where everybody's podcasting around you. But I really hope you've been enjoying the guests that I have had on and the episodes I've been putting out. And by the way, if you find these podcasts useful or entertaining or helpful, go to iTunes or Spotify or whatever platform you're listening to the show on and give it 5 stars and leave a rating. That would be very much appreciated. And with that, I think I'm going to wrap it up here. Thank you guys so much. It's been really nice sitting down and having a solo episode and just being able to sit and talk to you guys. So I really appreciate all of your support and all of you guys downloading and listening to the show. Within the last week, this podcast has really blown up, and that's all thanks to you guys. So if it wasn't for you guys downloading all of these episodes, I wouldn't be continuing to do this. So it's all for you, and I just have a blast with this. And finally, if you want to be a guest on the show, it doesn't matter if you're a pre-dental student or if you're a dental student or dentist, I would love to have you on the show. I'm starting to put together a list of people to interview now that my backlog of episodes is coming to an end from the Voices of Dentistry. So I'd love to have you on. So thank you guys so much, and I will talk to you all soon.